Richie's just been
shroud that.
This is the moment he's been
just
waiting
like
for.
itching.
Acting like he likes us.
I'm just
and
gonna
he's
shut
gonna
your
put
camera.
us in the grave.
Yeah, that's right.
It's
Right.
like,
Here's what I
you
have
guys
to
are
say.
I've been holding this in for 5 years. Yeah, but what are we going to talk about?
Why chiropractors suck.
Gosh,
Not.
Yeah.
I'm having a good time. Not.
No, we kind of thought about, what kind of, what would be the description of that take?
Why chiropractors are full of crap.
Yeah.
Why they're not legit.
Yeah.
Why insert negative connotation,
Yeah.
right?
Mm-hmm.
Basically, because there's a lot of them, unfortunately.
Well, yeah, it was last week while I was taking care of business at the clinic. It was fine.
Jury duty.
It was funny. On the same day, I had a gal come in who's, I think, family member. I'm not exactly sure, but they are going through medical school, ER type of residency right now. And she's like, I made a promise not to get my neck adjusted.
Is this my...
Oh, yeah.
Yeah, I told
she
you
came
about
in.
her.
Yeah.
Okay.
Yeah. So that happened. Dr. Zach can talk about that, but it was interesting having a conversation with her because she was like totally open to it, but she's like, I made a promise because my family member is like, do not. They always come in here. People getting strokes from chiropractic
And
adjustments.
Granted, he's like, he works in like the ER.
Right. Where
So he's
all the
he
strokes
sees-
come in.
He's probably like, never go on a boat, never jump on a trampoline.
Yeah.
Like,
Just don't go outside in general.
yes.
Yeah. If you don't want to do something, don't jump on a trampoline because you're guaranteed
are
not
really-
to have a good time.
Yeah.
So I had that experience, and then I had kind of juxtaposed to that. It was on the same day. I
Is
had
this your word of the day?
no.
Like, do you have a little
Do you know?
calendar?
Do you
like,
know
I can't wait for our podcast.
I learned juxtapose in 6th grade. We went through like this whole alphabet book, and juxtapose was one of them.
It's a fun
never,
word.
yeah,
I use it a lot too, actually. I think incorrectly most of the time, but
yeah. It was something about an animal taking a pose, juxtapose next to something like a rhino next to a mouse.
Oh, yeah.
Juxtapose these positions to show
Sure.
their difference.
yeah,
Or
that's a good teacher.
Mrs. Larson's class.
Shout out.
Anyway,
Smash
then-
that like button.
Yeah, she's not watching. She probably doesn't like chiropractors. But the next person I saw was a guy who I haven't seen for a while. I just asked him how he was doing. He's like, yeah, it's a little bummer. My buddy died while he was getting knee surgery. And I was like, oh, interesting.
Jeez.
I wonder what that stat is. So that was, and we were talking about our podcast, and I was like, you know what? Let's talk about
Yeah.
why chiropractors suck and kind of debunk or just like list our reasons of like why we're effective and why we do what we do. Because I think we're obviously an important part of the healing community, and risks and rewards, man. That's what it's all about.
And there's like an unfortunate amount of shade thrown your way too around like
We're a very easy target
you are an easy target.
because
Like
I think we have some sucky people in our industry that take
Right.
advantage of stuff
Right.
that, can't be studied, but they know anecdotally it helps. And,
Yeah.
there's a lot of justifications for what you do in a profession. So I think as an industry, like we need to like step back and say like, okay, what's appropriate? And I think the majority of chiropractors out there don't take advantage of it, but there's that set few that do. I was pointing past you.
there's somebody in the other
Yeah.
room.
One of the interns here?
So yeah, why do
Yeah.
chiropractors suck?
Man, are you asking me?
Yeah.
You know what?
What have you heard?
One of the things that comes to mind is, and I've been sucked into it before, in past treatments, is like it's almost you could even like akin it to a Ponzi scheme almost, where you're like, let's get this patient in and just milk them for as much money as we can,
And that sucks.
and that sucks for me and everybody out there listening that has had that experience before, and it's I think that's one of the reasons that people have this negative connotation around it, because it's like, oh yeah, I'm gonna go and they're gonna want to see me every twice a week for the next 5 years, and I'm gonna just keep going. That's crap, and that's not true. And I can speak because I've seen a lot of good ones, and you two sitting across from me are two of those. That's like, no, like let's get you fixed and then maintain if we need to, and yeah, so. That's one thing.
I have something to say about that.
Yeah.
And he probably has similar thoughts, but we have patients who come in all the time with that thought. And I usually say, well, what's your goal? Because some people might need to come in twice a week for 5 years, depending on what they're presenting with, or they have a chronic condition that it's like, we need to stay on top of this. And if you don't want to do stuff on your own, like, we're a good way to access, some movement and get you feeling better. And if that's the expectation, then
Yeah.
let's
That's
work
a different
on it.
timeline. Yeah. And that's the whole conversation of having that when we meet with people. Yeah. What are your goals? Oh, I want to train for a marathon.
All right.
Okay.
Don't do it.
I'm probably going to see you for a while.
Yeah. It's like if you were training for a marathon, you're not going to run every day for a month
Right.
and be like, oh, I'm good.
Yeah.
No, it's like time and consistency. So to that point, and I tell people too, like, I love all my patients, but I don't want to see you 3 times a week for the rest of your life.
It's kind of boring.
Yeah.
Yeah. And there's just, you don't have as much stuff to work on.
And if you're not improving, then there's something else going on. And I think we talked about, did we talk about that on a podcast? Like our expectations as like our clinical brains as it is right now. Like, we both come from clinics that had care plans that were appropriate per like what was presenting. But there's some clinics out there that it's like, they're just doing adjustments and they're telling people to come in 3 times a month or 3 times a week for, at least 3 months. And it's just like, boom, 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 boom. Can we all hear that background
Yeah.
noise?
Hey, out there.
Excuse me.
Hey, there's a
Trying to do
podcast.
something important in here.
Why is the door closed?
Anyway,
Yeah.
so
Well, no, that's interesting.
I do have some personal gripes with some clinicians out there. It's like they come from a good place. Like, their goal is to help people feel better, and I think my enthusiasm sometimes gets mistaken for like, yeah, I want you in here. Yeah, pushy.
Right.
And I usually have a conversation like, don't misconstrue
Yeah.
my enthusiasm.
Yeah, because you're not pushy.
It's just like, oh, we've seen this before.
Excited.
Let's get
Yeah.
you in.
Yeah.
Yeah, this is what it's going to take.
Yeah.
Like, I want to see you X amount of times for the next couple weeks.
Right.
And then,
I mean, he and I, we had a discussion when we bought this practice, and we're like, I was burnt out with some of the treatment plans that we were doing, but we were doing a different type of chiropractic care where I was, and he had some similar stuff like with decompression therapy and spinal traction. Like, that takes time and effort and frequency, so that's all appropriate. But for us, I was like, dude, I don't want to recommend anyone more than a month of care right now. I'm so over like,
Sure.
well, you got to come in 3 times a week for 3 months and blah, blah, blah. And it's just
Yeah.
like, I know what I can do. I feel
Yeah.
very confident in a month. Like, if we don't get you feeling better, 6 to 12 visits is kind of like my goalpost. Like, 8 is a sweet spot because it's twice a week for 4 weeks. Like, if we do everything we can within that time frame, just like working out too,
Right.
like, you're going to feel better. And if you're not, there's something else going on. And let's either talk, move you on, or,
yeah. And that was our starting point for most people. Like, that wasn't the end of their care, of course, but it was kind of a starting point.
phase
And,
1.
Yeah.
We've seen providers that have undertreated. We won't say,
Yeah.
but we've seen people that have undertreated, and it's like, well, that's equally a disservice.
Sure.
Almost more.
Opinion, yeah. Opinion alert,
Yes.
hard take, is,
Zoom in.
underserving is almost more detrimental than overcaring for.
Could I ask
You
a
know,
question about
yeah.
your opinion? What would be the reasoning for underserving? Like unintentional underserving, or
Probably same thing, coming from a good place. I mean, it always kind of starts coming from a good place. I would say underserving, because you don't want to come off as like
Right.
a crappy chiropractor,
Yeah.
right? That's why chiropractors suck, is
Yeah.
because so many people are commonly here like, oh man, once you go once, you have to go forever,
Yeah.
which we can get into that.
I'm into that.
But probably the same reason. People underserved because the providers, sense that, and they may have their own ingrained opinions about that.
You and Dr. Carey were talking about that this weekend.
Were we?
Like, your bias. Like,
Our
going
bias.
into treatment plans.
Oh,
like,
treatment plans. Yeah, we
I
always have
don't
a
know.
bias.
Like, this person needs a lot of care, but I don't want to say that.
Yeah.
Because I have a problem with it.
Yeah.
Where, like, it's money, it's time, it's
Yeah.
family commitment, like, whatever.
Yeah.
it is.
We were talking about the money side of it, which is true. It's like, well, yeah, stuff costs money.
Right.
Like
It's a tricky profession because there's not many doctors that are having to deal
with the money.
with the money end of it,
Right.
right? That's
And that's
taken
our
care of
fault
in the
too.
back end.
You know,
right?
like we could have structures in our clinic where like,
Sure.
here's the plan. X person will talk to you about the cost. Bye.
Sure, but
you know, there's
you're
some
an entrepreneurial startup small business, so you can't really afford all those extra
Right.
infrastructure builds. So
Yeah. So that's probably that's my thoughts, my opinions on that. So
yeah, and there's some chiros with like their ego is like, well, if I can't get you better in 2 or 3 visits, then you know, if
Yeah.
anyone else recommends more than that, they're crap. And it's like,
that's-
no,
Well,
it's not true.
and we hear, you know, can we talk about the school?
Yeah.
Okay.
Northwestern.
So-
I mean, like so here, preface this. We work with Northwestern, like our school that we went to. We take interns and we help them learn in their last year of clinic. Like Northwestern does a good job, but we have opinions, and that's
Good
okay.
opinions.
that's why this
Yeah,
podcast
and-
exists.
Go for it.
Well, to your point, you're saying a lot of people think that they can get somebody better in 2 visits, which is like, no, that's
it
not
shouldn't
correct.
be a personal challenge, right?
I would say
We
like,
can move people on pretty, like we can help
Yeah.
them feel better.
and this might be generalization, but a lot of times if they feel like they can do that, they're kind of they feel like they're coming from a place of evidence based, which is actually not true. Because if you look at the evidence for like acute care, like minimum is like 4 weeks, right? Like
Like
2 to 3
standard-
times,
yeah,
2 to
standard
3 times a
procedure.
week for like 4 weeks is like if
Sure.
a person comes in with like acute pain or whatever it is,
Yeah.
like that is actually what the evidence supports. Man, but if you can get somebody better in 2 visits, cool,
Rock on.
it's great.
Right.
Like then like change your game plan, right? So not getting fixed on like,
Yeah.
you know, being adaptable too, because we have that too, where it's like, hey, this is my anticipation for you. This is what I've seen work. Let's give it a shot. If we need more, then we'll cross that bridge when we get there.
Or
if you
less,
need
too.
less.
What I would wonder
Yeah.
too, like, as a business owner of my own, like if you have a certain amount, you have a nut you have to meet every month, and you're like, well, I did such a great job, or like this particular patient worked out so well that we got him better in 2 days or 2 treatments. My forecast for the month is going to be a little low, right? And that I'm not saying that, but there is that temptation of being like, well, a bad chiropractor would push that along a little further because they have a business they need to run, and that's probably the most evil reason to keep seeing somebody. But I would imagine that would be part of
And that's rampant
those
across
decisions.
all industries. I would
Absolutely.
assume. Like,
Yeah.
You need
I got-
return business.
I got my nut to hit, so I'm going to prescribe this thing to this person because they're indicated, and we're going to do it.
yeah.
Yeah.
I mean, our chiropractic or doctor's oath is like first do no harm,
Right.
and I would say the second one is please don't take money aggressively. Yeah, it's a tough one, but I mean that's the business side of the thing, and I think like we're in a position now where we have less of that pressure, and we're always looking for new patients, and if you want to come in, like please do, like we want to help you, but
But to that point, because we give honest, realistic expectations and we go over goals with every patient, they have a better patient experience. So like people come in just to come in. They get tuned up and whatnot, but they enjoy like our
essence.
essence per se. So
I like your essence. I can soak it in when I come.
But I mean, it's like the vibe of the clinic, and you come in
Totally.
and you're like, oh,
Yeah.
this is a comfy place. Like we had someone came in who hasn't been here in a while, and they're like, oh my gosh, it looks so good in here.
Yeah.
Like I just want to hang out and read the magazines. I'm like, yeah,
do it. There's coffee over there.
I saw somebody just watering your plants the other day.
yes, they take care of us.
That's fantastic.
So great.
I think we talked about this before too, but like a powerful thing in this industry as chiropractors is like the frequency of visits is sometimes a benefit because we can teach people different things each time they come in. It's not taking up a bunch of people's time. If you can build someone's locus of control and like handling their symptom or their, current physical situation, like I really see a ton of value in that. As a personal trainer, like I saw people develop as like humans who understood their bodies more.
Right.
Like if you're listening, Frank, you met Frank, you haven't met Frank, but he was my first personal training client at Lifetime. And like the first visit I saw with him, like I had this whole game plan. I was ready to go. I'm like, oh, we're going to do this workout. And the first thing I did is like, okay, let's get on the floor. We're going to do some mobility work. he had to like fall down to get there. I'm like,
Oh boy.
well, this is not gonna. That was like the first like.
Rethink this.
Yeah, so I was like, we got to do a whole different schema,
Mm-hmm.
and I think that translates to my chiro side of things because like you have intentions with people and you want like here's the game plan, but patient that came in today, she's like, God, my neck hurts and I'm having headaches. You know, that was like she had mid back stuff going on. We started working on her recently. And I kind of look back and I'm like, well, how have you been feeling? She's like, I had a couple of really good days and I have some bad days. I'm like, great, let's keep working on you. Like, that's the whole point. And she's like, you know, worried about some things, which we were going to talk about today. Like, oh, am I having a stroke? Well, probably not.
Yeah.
So, I mean, we can pivot right into that.
I thought that was really interesting. You
that's a
talking
good,
about that. Yeah.
good pivot point.